Well, there's been widespread criticism of government's lockdown regulations, with some labelled as irrelevant, such as control over what clothing consumers can purchase. The CEO of the South African Medical Research Council and also a member of the Ministerial Advisory Committee, Professor Glenda Gray, also found herself in the eye of a storm this past weekend after labelling government's risk-adjusted strategy for dealing with the coronavirus pandemic as unscientific. I'm now joined by Dr Kerrigan McCarthy, who's a specialist pathologist at the National Institute for Communicable Diseases and also a member of the Ministerial Advisory Committee. Thanks so much indeed for joining us this evening, Dr McCarthy. So quite a lot is being said and coming from scientists and people with medical backgrounds. Us poor citizens don't know what to make of it. So help us unpack some of the comments that were made over the weekend.
Evening, Peter, and evening to your listeners. Yeah, I can imagine it can be quite confusing to be faced with many apparently contradictory regulations and responses. And I can say that there we're not alone. I think what is important to contextualize the situation we find ourselves in is that the world has not faced a pandemic of this crisis the last 100 years, and certainly not since we've had the technology we do. And there's certainly no equation or formula of how a government should go about implementing interventions in order to reduce lives lost due to COVID. As a consequence, each country has to figure its way through this process. And we do so using the best available information to us at the time and with the best intentions to save lives. Criticism is most certainly part of an ongoing dialogue around how we as South Africans, government, civil society, can collectively make the most of the situation in order to reduce lives lost, both through economic consequences and through consequences of the virus itself.
All right, so let's start unpacking some of these things. Let's start with the whole lockdown issue. Throughout this, what I've been hearing constantly is that we're trying to slow it down. There was never anyone saying we're going to stop it by doing a lockdown. So implicitly what it meant to me is that we're going to have a COVID-19 problem. X number of people are going to get it. All that's going to happen is that it's going to happen slower with a lockdown, but we'll eventually get to number X, whatever that number is. If that's the case, isn't it that we've done what we needed to do to get ready for it?
Yeah, look, I think there are, a number of interpretations of what the intention of the lockdown was, and some folk hoped that it could achieve more than what it has. But what is certainly clear is that the lockdown has delayed the exponential rise in cases by a few weeks to a month or more, 6 weeks or so. And during that time, we have most certainly as a country across the provinces been working incredibly hard to prepare our health systems to receive increased numbers of cases. So for me, that really is benefit of what the lockdown has achieved for us.
I guess what I'm asking is there a number X that we will get to either quickly or slowly, depending on the interventions? Will we still get to the number X of people that are likely to be infected by this virus by its very nature?
The answer is yes and no. That X is a movable number. The X is a function of what we as epidemiologists call the R0. That's the effective number of secondary cases that are a result from a primary case. Now, if we are able to implement social distancing in a way that reduces the spread, we most certainly will be able to prevent an excessive number of cases. But there's no doubt about it. If we don't implement social distancing, we will have to, we will unfortunately see a X number of cases. And that means that vulnerable people who may have poorer outcomes with COVID may get infected.
Right.
So, unfortunately, in the absence of a vaccine or therapy, the only way we can prevent the spread of this condition is through social distancing. And if we implement social distancing in a determined and intentional and consistent way, we can decrease that R0. In other words, decrease the number of people who would be infected. So it may be possible to reduce the number X. And in other words, the answer to your question is no, there isn't an X.
All right. So is social distancing a lockdown, or can we find ways to social distance beyond a lockdown?
Absolutely. There are graded ways that we can implement social distancing. I mean, if we want to stop the infection in its tracks, then we all need to stay at home today and never leave. And of course, that's an impossibility. But if we implement social distancing in responsible ways that continue to allow us to go on with our livelihoods, we may still effectively reduce transmission and reduce the number of cases that are infected.
Is Professor Gray wrong then when she says that we've gone past that phase? We're in a new phase now where we really should be just concentrating on helping and protecting the vulnerable.
Well, I think that's a matter of robust debate. I mean, if we interrogate what Prof. Gray said and you speak to her, she'll say that she's in fact in support of the lockdown and graded responses, but perhaps the nuances of that in terms of some of the regulations she was trying to reflect critically on. So I don't think her statements should be taken at face value. I think there's always a backstory. One needs to appreciate the context of what she's saying, and also to recognize that she is a person like all of us, and the lockdown is not an easy thing to live through.
All right. Let's talk a little bit about cigarettes, because that's become a contentious issue. What is the medicine or the science behind banning cigarette smoking and the selling of cigarettes during a lockdown? Because it's actually, in real terms, a short period of time. If you were a smoker, stopping for 3 months is not going to change your pathology, I wonder.
Peter, I'm by background an epidemiologist and a medical scientist, and the nuances of cigarette smoking is not my field of expertise.
Yeah.
But what I do know is that cessation of cigarette smoking, even for a few months, produces improved lung function outcomes. The cilia, which are the mucociliary escalator and natural defense, start coming alive again after as little as 12 hours. So, any medical practitioner will tell you that cigarette smoking is not good. Yeah. Now, whether that should form part of our regulations is really not for a medical scientist to debate, but for more rather a social scientist and perhaps a politician.
All right. What lessons can we learn from other countries? I mean, we hear about Sweden and its herd immunity program. Talk to us a little bit about that. And is there something there for us?
Well, like I said right in the beginning, there is no proven, absolute cast-in-stone gold way of approaching this pandemic. What is absolutely certain is that it is here, and we and our leaders are doing the best that they can to interpret what is known about the coronavirus and coronavirus prevention into our South African context. Our population is very different from Sweden's population. We have about 6.5 million people who are living with HIV, and of whom 5.5 million are on antiretrovirals. Sweden has a population that is very well nourished and has very good access to universal health care. So, one size doesn't fit all in this game. Certainly, after the outbreak is over, the pandemic is over, there is going to be a lot of dissection and analysis of what each respective country did and how we applied the various guidance at hand into our particular context. What I can say is that our country was absolutely spot on to implement the lockdown when they did. A lot of other countries waited too long. And as a consequence, we have had a lot more time to prepare and get ourselves ready for what hopefully will not devastate our country when it comes to fruition.
All right, so Dr. Kerrigan McCarthy, we're going to have to leave it there, but thanks so much indeed for your insights. And it looks like scientists will debate robustly, which is good, and hopefully we'll all come to the right conclusion. But certainly, as you said, this is something that we're learning as we go along, because there is no precedent for what we're facing. Thanks so much indeed for your time this evening. All right, she's a specialist pathologist at the National Institute for Communicable Diseases.